too familiar to us now, COVID cases, hospitalizations, and deaths are all on the rise. And this is being driven by two major factors: a much more contagious version of this virus and vaccine hesitancy. And in order to understand what these two are independently and how they work together, we need some context. My name is Joseph, and this is the Atlanta Journal-Constitution in Context. First, I think it's important we start off with the million-dollar question. What do these vaccines do? Well, the Centers for Disease Control and Prevention reported both Pfizer and Moderna are 95% effective at preventing COVID and 99% effective at preventing hospitalization. Even with these vaccines being safe, effective, and free, there is still some trepidation about them. According to the Georgia Department of Public Health, only 40% of people in the state and 49% of the nation are vaccinated as of recording this video. And why is that? That's a question I asked Dr. Carlos Del Rio, an Emory infectious disease expert. He told me,
when we started getting people vaccinated, we pushed the vaccine out first to the older individuals because, the mortality of this disease was highest in people over the age of 65, right? Mm-hmm. So it was very easy to get somebody over 65 get vaccinated. The options were death versus vaccine. Most of them knew somebody who had died of this disease. In younger people, the mortality is a lot lower. So it's very hard to tell somebody in their 20s, look, this vaccine is going to save you from dying. They're going to say, look, all my friends have gotten COVID and nothing happens to them. So that argument doesn't work. So you need to tell people what is the benefit of getting vaccinated.
So while yes, people in their 20s and 30s are not likely to be hospitalized due to COVID-19, there can still be adverse reactions. Just because you probably won't die from it doesn't mean nothing bad will happen. Johns Hopkins tells us there can be long-term damage to the lungs, heart, kidneys, brain, and other organs.
Young people are very concerned about the impact on fertility. It's fake news, it's false, there's no impact, but anti-vax groups have created this myth and this false story that I think is limiting. A lot of young people say, well, the other day I had somebody call me and say, I'm worried about vaccinating my kids because I want to have grandchildren. I said, this has nothing to do with that. But again, people are concerned about that, and that has been a barrier.
And just like the good doctor said, it's false. Like, there really is no data to support this claim. It's just classic misinformation.
And then the third thing that I hear a lot is this issue that they were developed too quickly and they haven't been tested enough. And I could tell you that where they weren't developed too quickly, they were developed, we were very lucky that getting them so quickly, but they were tested, they were thoroughly tested, and vaccines now be given to millions of people. And what to me is this unfortunate and disappointing is that the FDA has not yet given a final approval for the vaccines. We're still on an emergency use authorization. And I think when the vaccines get full FDA approval, that's going to change.
Now, the undercurrent to all of these concerns is a lack of trust, and a lack of trust for our institutions. For instance, the Black community is no stranger to being wronged by the American medical system. And I know watching a video on the internet is not going to make a large number of people get vaccinated, but some people may start the conversation that will eventually lead to that. Like Dr. Del Rio said.
Today, somebody from food services stopped me and said, hey, Dr. Del Rio, can I ask you a question about the vaccine? And I started talking to this person who's been on the fence. And all of a sudden, this person said to me, okay, you convinced me now, Dr. Del Rio, what vaccine did you take? Because I'm going to take the one you took. So, a lot of times it's just that one-on-one convincing, that one-on-one messaging. It's really listening to people, and they need to hear from a trusted source. So what we need is people that have been vaccinated to talk to others about it, right? And whether it's your pastor, whether it's your friend, whether it's your neighbor, but if you've been vaccinated and you see somebody that hasn't, don't blame them. Talk to them, ask them why. Here are their questions.
Vaccines are safe, effective, and life-saving. And this pandemic is like a group project. Everyone has to do their part. But vaccines are only half of the picture. We still have the Delta variant to worry about. Every time COVID reproduces, it has a chance to grow and mutate. Dr. Del Rio told me.
The original strain, one person infected 2.5 to 3 people. Let's say 2.5. So 2.5, each one of them infected 2.5. So now that's, 2 people infect, 2.5 people infect 2.5 people and grows and grows and grows and grows. Well, the Delta variant, 1 person infects 6 to 8 people. Each one of those infects 6 to 8, and each one of those infects 6 to 8. So if you're talking about a fully naive population, if you threw the original strain into a fully naive population, after 10 cycles of transmission, with the original strain, you had gone from 1 infected to about 9,000 people infected. With the Delta strain, after 10 cycles of transmission, you've gone from 1 infected to 30 million infected.
Wow.
That's what exponential growth means.
Yeah.
And that's why if you look the curve, it's like this, it's like a rocket, right? Because exponential growth means really going up very quickly. And therefore, the point is that your chances of getting infected increase exponentially. And what I tell people with the Delta variant, if you're vaccinated, you're safe. You're going to be okay. If you're unvaccinated, you're toast. This virus will find you.
My colleague, Ariel Hart, got to ask National Institute of Health Director, Dr. Anthony Fauci.
It's like half of Georgians think things are returning to normal. And among those who have not been vaccinated, 1/3 are in a wait and see mode, and half do not intend to get vaccinated. So that's about 1/4 of the state do not intend to get vaccinated. What would you say to them?
First of all, find out what the reason for their not wanting to be vaccinated, because you don't want to make things unidimensional. People have different reasons for not wanting to get vaccinated. So I would certainly not take a finger pointing attitude towards them and tell them how terrible it is that they don't want to get vaccinated, but more trying to do a conciliatory approach to try and figure out what is it about getting vaccinated that they do not want to do, and explain to them the importance, not only for themselves, for their family, but also for the what I would call a societal responsibility. Because if a person doesn't get vaccinated, and it's usually a young person who feels that they're somewhat invulnerable, and if they get infected, it's not going to make any difference to them because they unlikely will get serious consequences. And it might be in their mind that it doesn't make any difference to anybody else. And that's where they're mistaken. And that's where we've got to get to them. Because by getting infected, they are really propagating the transmission chain of the outbreak. And they're really being part of the problem. So if they think that by not getting vaccinated and getting infected, that it's no harm to anyone, including themselves, well, it may not be a direct harm to themselves, but they may be unwittingly, inadvertently, and innocently passing the infection on to someone else who would actually have a dire consequence.
There will be a full link to that video in the comment section down below. Also, if you're concerned about vaccines or just COVID in general, I have linked the Georgia Department of Public Health's frequently asked questions down there in the description. So if you have any questions or comments or things you want us to cover, let me know down there in that comment section down below. And hey, while you are down there leaving your very carefully worded comment, go ahead and press that subscribe button if you haven't already. Press the like button if you liked this video. Favorite if you really liked it. But as always, my name is Joseph, and this is the Atlanta Journal-Constitution in Context.